This is Every Widow Thing. Welcome to another episode of Every Widow Thing. I am very excited because today we have a special guest on. It is my dear friend, Dr. Angelique Campen. She's been in emergency medicine for over 20 years at Providence St. Joseph Medical Center in Burbank, but also a clinical professor of emergency medicine at UCLA. She's the mother of 3. She was recently named by fellow practitioners one of both LA's top doctors and Burbank's top doctors. We're very lucky to have her here today. She's here to give us some important tips regarding hospital stays and how to be an advocate for yourself and your loved ones. So thank you, Angelique. Welcome.
Yes,
Thanks
thank
for
you.
having
Thank
me.
you.
Let's just dive right in to some of these hospital secrets.
Well, the first thing I want to say is this is not the time to be liked by the medical community. This is when you don't want to be your doctor's favorite patient. You want to be the advocate. You want to speak up. You want to get what you need. You want to get answers. You want to get time. That's really a rare commodity from healthcare professionals, is getting their time, getting them to
Right.
sit down and talk to you, answer all your questions. You want to get all of that knowledge from your healthcare professional. It's not the time to say, "Oh, okay, I don't want to bother you. I don't I."
Or make them mad. I was always afraid, oh, they're not going to like me.
So a lot of times we really try to grab the doctor or the nurse, and they seem rushed to us. And it's probably because they are doing a lot of things at the same time. They have a lot of patients, they have emergencies that come up. So the best way to really get their time is to make sure that you're getting them at the right time. So when they're rounding in the morning and they're coming around and they're getting every patient set for the day, that's probably not the time for them to sit down and have a 20-30 minute conversation with you. So starting your conversation with, is this a good time? Because I have a lot of questions for you and I really need your attention. You can call them, you can page them, you can definitely find them.
Or you're specifically speaking about the doctor that is handling, and I don't even know. I feel like there are multiple doctors handling one person. It's not the same doctor every time.
Well, yes, it depends on what situation you're in. Some places it is the one, you have consistency and you have the one main hospitalist that's handling you. Sometimes they change daily. It depends on the system in your hospital. And then they will call in specialists. So it's important to know to whom you're talking, um, who is in charge of what, and to catch them at the right times. There is no harm in saying, look, how do I reach you? Because every doctor, you can page them, you can have their cell phone number, you can, the nurse can page them. There should never be a time that you need them and you can't get in touch with them.
Okay, so it's not inappropriate to ask for a doctor's cell phone number, is what I'm hearing, for medical purposes.
I actually did not understand that you could do that either. I thought it would have to go through, that they wouldn't give out their cell phone numbers.
All you have to do is ask.
Okay, that's good to know. That's really good to know. I had no idea.
I also liked one of the tips that you gave, kind of in the same realm of this with information, is you want to know what information is being passed on to each doctor or nurse when they have their shift change.
Yeah. Not only when the doctors do their shift change, but the nurses. Because think about it, the doctors, they may not be doing the 24-hour care. So the nurses are just as important to make sure they have all the right information. So what I usually do is I say, when you have your change of shift, when you have the nursing change of shift, can you please do it in the room with me? And that way number one, you can correct misinformation because you don't want it to get passed along all this wrong information. And number two, that's when they're discussing the plan. Okay, this is what's happening. This is what's expected to happen tomorrow. These are the results that came back today. And you will hear a lot of information that you may be waiting to hear. So always on that change of shift, I would have them do it in the hospital room.
That's invaluable, I think. And a notebook. Have a notebook, because some of the stuff they're going to be saying, you won't even understand what it means.
There's one funny tip I want to give you of how to make sure that your loved one or you are getting a lot of attention is people in healthcare for some reason are always hungry. So if you
Oh,
keep
yeah.
a box of donuts or bagels or some sort of snack in your room, trust me, everybody will come by and you will never be having to call for a nurse or someone. They will just come by and say, "Do you need anything? Is everything okay?" But really, your key is the person that's taking care of them at that time. And if you can have really clear communication with the nurse and say, "Look, I'm leaving. This is my information. I want to be called for everything and anything."
And if possible, like have someone else hospital, like there was always someone else in the room, but you don't always have that. I mean,
Right. Your person was the person that
Yeah.
would have.
Yeah, and he
been
was in a
switching
coma,
off.
so it was a little hard to.
I do know Angelique, because Angelique had preemie twins. I remember hearing the story how they were in the hospital for quite a while. You did not want to leave at all. You weren't sleeping. You were literally there 24/7 until friends kind of tried to coax you and pull you away.
Yeah, and if you need to leave, it's good to kind of play tag with someone and have someone stand in for you.
Well, let's move on to some of the tips about hospital stays.
You know, just like you check your bill at a restaurant and you'll see things added on there that you didn't order, go through your bill in the hospital. You can't believe how many things get put on there. You asked the best time to go in. Well,
Right.
if you do have the luxury of scheduling it, um, don't go in on a Friday. Even though medical emergencies happen 24/7, some things are not available in a hospital in the evenings or especially over the weekend. So, getting checked in for something on a Friday afternoon, your procedure or your surgery may not happen until Monday. And so you are in the hospital for all those extra days. And guess what? Where are the sick people? They're in the hospital. So I try to tell people minimize the number of days that you are there and only actually be admitted to the hospital if you 100% have to. Um, you're not going to get rest there. You're going to be exposed to lots of other bacteria and sickness. Um, which brings me to yet another thing. Make sure you have uh, a hand sanitizer or the gel with you, because that thing that hangs around the doctor's neck, guess where it was before it was on you or your loved one? It was on the previous patient.
Right.
And
That's not getting cleaned every
yeah, they do
round.
wash their hands. How often do you see them wash their stethoscope? So you'll want to ask for them to do that as well.
That's a great tip.
Ways to advocate without being rude. I mean,
Sure.
you can say, "Look, I've heard a lot about hospital-based infections. I'm doing my best to help you help my loved one. Here, can you clean your stethoscope?"
Right. Yeah. That's a good tip. What tips do you have in regards to medications in the hospital?
So people uh, or medical professionals are human. They make mistakes. So anything that goes in your IV, any pills that are brought to you, you need to ask, what is this? And why and if you don't recognize what it is, why am I getting it? Because let me tell you, not too many times they're in the wrong room and they hang it into the IV and whoop, that went into the wrong patient.
Oh my gosh.
So fortunately with technology, sometimes they'll scan the 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 band that's on the patient's wrist, but still human error. So it's always good to have that second check and just to ask, what is this and why am I getting it?
Yeah, anywhere else we go, if we're at a restaurant or something, we ask a ton of questions. And then when you're in the hospital, you're just mute and you just let everything happen because you seem to think that they know better.
And a lot of the pills look the same. That's how I remember reading that happening at Cedars-Sinai in Los Angeles. Someone had given a pill that looked
And there's many
similar.
times, yeah, that they're giving you something and you may not need it.
Right.
Right.
So just, ask what and why.
What
And
about
what-
all of the doctors that come in there at the same time? There are always, sometimes there are 3 or 4 that come in. Some of them are going to be out of network. Some are in network. I know this is kind of a different thing, but I kept going, wait a minute. I don't need 3 of you to come in for the same thing. And they were I noticed because my kid was I was in preterm labor in the hospital for 3 months, much probably different because yours was probably post once you had your twins. But I noticed there were a lot of people coming and I was getting charged for every one of those doctors. And like, how do you minimize that?
So you are in charge. That's what a lot of people forget is you are in charge of what happens and what doesn't happen. So you are allowed to say, you know what? You can ask the main doctor, why is a cardiologist coming in? We don't have a cardiac issue. And you may say it in a nice way, say, I don't see the value. Because sometimes when they'll ask a consultant to come in and give an opinion, the consultant will just continue to come every day until the patient's discharged. Well, they may not be needed any longer. But guess what? Every day that they come and they write a note,
Right.
they are billing.
Yes.
Right. Interesting.
So you
You're not paying for when you're in a student hospital, though. Like at UCLA, if they come in and there are residents with them, are we charged for the residents?
you
Yes.
sure you're not charged for-
Oh,
you're charged for their supervisor, the attending.
What
So
about,
have
I
someone-
understand you don't have to have the nurse, if there's a nurse you didn't care for, if you're long term in the hospital, like I was, I didn't know that you could ask for a different nurse. Can you do the same thing with a doctor as well?
definitely, I've been places and not uh, been thrilled with the nurse assigned to us, and have asked for them to change the assignment, and you are able to do that.
and you can do it. It's not even just about personality differences or not liking their bedside manner. You can research whatever doctor is coming in, and is that the case as well? You can request, no, I don't want this cardiologist. I want this cardiologist. You can do that.
So as Whitney, you've heard me say this joke before. What do you call the person that graduates last in their medical school class? A doctor.
Yeah.
So there are different qualities of doctors. There's good ones and there's not so good ones. So you have to do your due diligence and not just say, oh, okay, you showed up and that's who I'm going to take. Sometimes in an emergency, you don't have time for that. But if you do have time, research them, look them up on your state medical board. You'll find out if they've had malpractice suits, if they've had, issues. You can see where they did their studies, how long they've been in practice. Ask.
Right.
Just
That's really good information because, like, when I went in the hospital last year,
Right.
I mean, I just was like, oh, okay, this is the doctor. And I just went with it.
Keep thinking too, like when the doctor, back to the kid thing, when you were there with your twins, I was there in preterm, and I remember them coming and asking me if it was okay if they brought in, because I don't think after being there 3 months, I got tired of reading that long bill.
Right.
But I was getting charged about $10 to $20 for a Tylenol, so I ended up bringing in my own. I mean, seriously, I did because I
Smart,
wasn't going to pay $20
smart.
for it.
And remember not, if you're in somewhere long term, not to forget the regular health things that you would do for yourself at home, like washing your hands before you eat. A lot of patients, when you're sitting in a hospital bed, forget to do that.
I never even thought of that. One other thing that I thought was interesting from your series on Instagram was about bringing in your own medications, which I always have gotten pushback and like, no, we can't take any of that. We have to administer it here. So can you talk about that a little bit for us?
So yes, you can bring in your own medication. You can't just bring it in like a little pill box. It has to be in the prescription bottle. Um, you may have to surrender it, and then they will inspect it and they will administer it, but you won't get charged for it. And this is really important when it's a particular brand of medicine you need, or a formulation, like if it's extended relief. My daughter takes a particular seizure medicine, and whenever she would go to the hospital, they would try to switch her to the not extended release one and say, "Oh, well, we're just going to give it to her twice a day instead." I said, "No, no, 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 no. This is what she's used to. This is what we're going to take." And so I would bring it with us, and so I highly recommend bringing all your medicines with you. Um,
Do you need
that
your doctor's note or a note from that physician or anything, or just that bottle of medication is enough?
Well, you do need the doctor in charge of you in the hospital to say okay to administer home medication. And so that's all that needs to be done.
Okay, that's really good information because otherwise
It's expensive.
it's not. Thank you. There were a couple of other things you mentioned earlier about how it's hard to get a good night's sleep in the hospital, and anyone who's been in the hospital knows this.
So in the hospital, and especially in the ICU, especially in the ICU, they come and wake you up every 3 hours and do your vital
Vitals.
signs, blood pressure, your temperature, all of that. If you are stable, and this may not be your choice, but you can certainly ask. You can say, "Look, I refuse vital signs in the night."
Yeah.
I
Oh.
I do that for my daughter every time she's in the hospital, because she needs. How do you get better if you're not getting rest? And so I tell them, "Look, no vital signs in the nighttime. Sorry."
Yeah, Angelique has not only the experience of being a doctor in the hospital, but she's been on the other side of that hospital bed. Her daughter has had multiple brain surgeries over the last couple of years. So she knows what it feels like to be in that situation.
It makes
So
you a
she's
more empathetic doctor, I
I know how
imagine, as
scary it
well.
is. I know how trying to get information, how hard it is to get information, but I also know how important it is that that you get the information you need. You should know. Uh, you should never come out of a hospital and not know what's happened. You should know the name of a surgery. You should know what happened during the surgery. You should know what medicines you were given. You should know why. You should know what illness you had. You should have all that information.
And you can get the documentation after the fact. They make you pay for it, and it's expensive. It was like $1 a page, something like that.
Oh, I remember that.
Can you get
Yeah,
it?
did you
So
get
no
it
matter
I got
what,
that. I had to get it for Zach.
Yeah, my husband died. Thanks for making me pay $400 for all the pay, but it ended up being quite expensive, but at least it's something good to have, because then I had someone else go back through it to make sure that things were done in a proper manner. And
Yeah.
it does help you kind of close the book on that.
is it worth having that paper, or if you're taking notes yourself, do you feel like it's still is it worth spending the money on that to get your own medical record from that visit?
Yes, I think it is worth it to get a copy of the medical record. Um, Nowadays, with electronic medical records, it should be easier to download it and not have to make copies
Sure.
anymore. You can do it on something called MyChart, but you would be surprised how many surprises you find in there that may not have been communicated to you.
Right.
Yeah.
Yeah, it's so interesting. I mean, really at the end of the day, what most of this is about is communicating with the people that are in charge of your care.
It's a fine line. Don't also think that you need to become the expert in it. That's another place that sometimes people go wrong. It's being an advocate is not now Googling something and thinking that you know everything done. If you have a friend that's in medicine, that's the time to ask them to help you out.
Right.
Hey, can I bounce some things off you? Can you weigh in on this? Can you make sure everything is that's supposed to happen is happening? And it's good to have someone like that in your back pocket.
Sure, sure.
Yeah, I had a friend after the accident that was a nurse, and she just wrote everything down. And so helpful, because it was like, some of the things were listening to a foreign language to me, and she could explain it properly and take notes for me. So
I have a question for you. And it's fortunate and unfortunate that one of my friends who became a really close friend after this was a lawyer. And I remember telling her, do not tell them you're a lawyer, because then the doctor feels more threatened. I could just feel it. So I was like, don't say that. Just say you're a friend of mine. You're helping me take notes and ask questions.
It's true. It's true. I think a lot of what happens in medicine is what we call defensive medicine. It's scans and tests that we know what the answer is, but we have to do it, because if you were to look back on something, you would wonder why did they not do this test? So that's true. There's a lot of things that we do and don't do because of lawyers.
Yeah.
One last question, because this is a widow podcast, and so it's about grief and death. I feel like doctors or the medical field kind of in the past has not really been schooled on how to handle death and grief. Yeah, can you talk a little bit about that before you go?
I remember being in medical school, and there were maybe a few days of something called doctoring, where they taught you the art of being a doctor, but really it's an art. And I don't think it's something that you can, it's something that comes with experience, both being the doctor, but also being on the receiving end of it too. And really it just comes with practice. Like I've learned that once you tell someone that their loved one has died, they're really not going to remember anything after that.
Right.
I try to get just a few things across. Now, mind you, I'm telling people in the emergency department of sudden deaths. I tried to assure them that they weren't alone and that they didn't suffer. That, I was with them and I did everything I could to handle their pain. I tried to assure them that there was nothing that could have been done differently that would have changed this. And I've learned to address those things, because those are the questions that I get afterward. Did you do everything? Did you do everything you could? Did they suffer? Did they hurt? Were they by themselves? Things like that. And so I've learned to go ahead and address those. And then I've learned to make sure to give them my contact information, because you're not gonna ask the questions you want to ask at that moment. And so they need a way to get back to you to help
Process
Process,
more.
yeah.
Yeah.
This is so helpful. I hope all of these people listen to this episode, because they're going to learn for the next time, which there will be with either a parent or another loved one. They'll know what to do. I'll know what to do better.
Yeah, I know. So we appreciate you taking the time. Dr. Angelique Campen, I encourage everyone to go follow her on Instagram. It's GlamERDoc, because she's not only glamorous, but she's a doctor.
I love that you're a mother as well, because it's hard work being a doctor and twins.
Yes. What was the last thing that you said, Angelique?
I just said, because I'm the glamour doc.
That's right. You're the glamour doc, and you play hard and you work hard.
And I love her pink nails too.
Yes.
Yes. Yes. Thank you so much, Angelique. Go enjoy the rest of your evening.
Thank you.
And
Thank
we so
you.
appreciate it.
You're welcome.
Staying alive.
Bye.
Stay alive.